Hi, I'm Dave,
And I'm Neil.
and we're excited to be answering your most frequently asked cannabis questions.
We'll be doing this through a series of quick, digestible Q&As with some of the most interesting characters in the cannabis space and the broader culture at large.
Today, we're spending 420 seconds with Dr. Laurence Kemp. Dr. Kemp is the medical lead for Can I Help? Having graduated from the University of Cambridge, Dr. Kemp went on to run a group of GP practices in Cambridge and taught the medical students at the University of Cambridge. He moved to Brisbane in 2018 with his wife and 3 boys as an experienced GP with a clinical interest in chronic disease management, including pain management and palliative care, and is now a member of the Australian New Zealand College of Cannabis Practitioners. We'll be talking to Dr. Kemp about patient access, including eligibility criteria, common conditions being treated with cannabis, and his upcoming presentation at the Australian Cannabis Summit.
Dr. Kemp, thanks for your time.
No, thanks very much for having me.
So we hear from a lot of patients and the public alike. One of the main questions that we get is around eligibility and the criteria. In your own words, what does that eligibility look like for patients?
Look, I don't think anybody like the TGA has specifically laid out the criteria in a kind of legalized form. In our clinic, the criteria we use, firstly, we want the patient to have been diagnosed with a condition that we know that that cannabis can be effective for treating. So, a lot of our patients would be patients with chronic pain, either from malignant or non-malignant causes. Mental health problems like anxiety and depression, post-traumatic stress, and then a number of other conditions as well, particularly neurological things like Parkinson's disease, multiple sclerosis, epilepsy. So they have to have an eligible condition to begin with. Number 2, we don't use cannabis as a first-line medical therapy, so we look to see that they've tried another form of therapy beforehand, whether that's another form of a licensed medication, or whether they've seen some form of therapist for some psychological treatment, or they've seen a physiotherapist to try and treat their chronic back pain or whatever the issue is. And then thirdly, we just like to make sure that there are no good medical reasons why they couldn't have cannabis. So we like to just make sure we're looking for people who could have had a heart attack recently, or have got any allergies to anything, or any significant medical problems that would make the cannabis using medicinal cannabis problematic for them. So it's quite a simple screening process, and I would say that we find that out of the patients that come to our clinic, probably 80 to 90% of them we judge that they would be eligible for a medical cannabis therapy.
Fantastic. And I mean, obviously it's great that there's more visibility of the SAS dashboard now, and we can kind of see what numbers of people are going through per condition. We know that chronic pain, anxiety, and cancer, I believe, are the top 3 indications people are getting treated with medicinal cannabis for. The word chronic comes up a fair bit. Would you be able to articulate what chronic means in the medical sense? Yeah,
so I think this often causes a lot of confusion. Generally, when I speak to my patients in the clinic, they use the word chronic to mean bad, and they use acute to mean bad as well. So, acute or chronic pain just means bad pain to a lot of patients. And from the medical perspective, the words have got quite different meanings. So acute means of recent onset, and chronic means long-standing. And generally, in the context of pain, we would describe a pain as being a chronic pain if it's been around for 3 months or more.
Awesome. The idea of a medicinal cannabis consult for patients is new and it's unique, and there's a bit of trepidation that patients have when coming into a consult. Can you talk to the people about what a consultation looks like when they come in for an appointment?
Yeah, no, of course. I would completely agree with that. And one of the things I'm going to be covering in my talk in the conference is actually just looking at the type of patients that come to see us. There's some really interesting statistics in that, we know that chronic pain is predominantly a condition that affects older people, but you look at the people that are coming to our clinic and they're mostly younger people. And I think that what we're seeing there is the effect of some of the stigma around this and some of the cultural and societal factors that are affecting how people present to our clinic. I think clinics work in different ways. We have a 2-step process in our clinic. So every one of our patients would speak to one of our nurses to begin with. it's just a very friendly, open conversation. The nurse will explore the background of the problems that that you've been suffering with, the issues that's causing for your life, a bit about your medical background, your other medications, and then particularly, focusing on, what you do for work, do you drive? All of these things are important in choosing an appropriate preparation. And what are you trying to achieve, from this? Are the expectations you have of this realistic? Are they stuff that's likely to be achievable with cannabis therapy? So that forms the kind of basis of the initial discussion. We then, for patients who want to proceed with our clinic, they're passed on to one of our team of doctors, and the consultation with the doctor covers a little bit of that as well, but is more focused on helping work out the best treatment plan. What kind of there's so many cannabis preparations out there, different strengths, different strains, different formulations. It's working out which one of those is going to be the most sensible one to trial a patient on, which is going to fit in with their lifestyle best, which one's going to hopefully provide them with help them meet the goals that they're trying to. And so there's two steps to it, but I would treat it very much like any other medical consultation. It's just often there's a lot of things covered, and we take a really holistic approach and assess people from multiple angles, really.
Yeah, and I think you really touched on something there, the fact that it is like just a normal doctor's consultation. I know a lot of people are intimidated coming in, and it's, a lot of people come out the other end saying, okay, it wasn't quite as confronting as I thought it was going to be. And it is just a private consultation, right?
Oh, for us, it's just kind of normal work, to be honest. We do this all the time. The way that we assess patients in terms of considering medical cannabis is very much the same that we would same process that we'd assess them for any other medication. All of our doctors all work in general practice as well, so it's there's nothing special about it. It's just using a different therapeutic approach to problems that they probably see multiple other doctors for in lots of other different settings.
That's it.
Exactly.
Yeah. And you referenced the Australian Cannabis Summit that's taking place last weekend in November 2021. You will be presenting. What can we expect to hear, and how do people find out about it?
So I've put together a presentation. I'm really delving into some of the statistics about the patients using our clinic. What ages are coming to see us? What's the gender bias there? And there is a gender bias. What conditions are we treating? And then also looking at, we've got some really interesting data from questionnaires. So when patients join our clinic, we get them to complete pain scores or depression and anxiety scores or sleep scores, depending on what their issues are. And we've got some really interesting data showing some really promising results with just 3 months of treatment on medicinal cannabis. So some really interesting stuff I'm keen to share with my professional colleagues and with the general public. I think the best way to find out more about it is to go to the website. There's full program there, very easy links to register. So it'd be good to get as many people who are interested in this coming along or attending virtually as possible, really.
Dr. Kemp, thanks for your time.
My pleasure.